Instruments required for Class 2 amalgam restorations are as follows: mouth mirror, explorer, tweezer, spoon excavator, cement spatula, plastic filling instruments, enamel hatchet, gingival marginal trimmers both mesial and distal, amalgam carriers, amalgam condenser, a small and a large condenser, amalgam carvers, Hollenbeck and discoid, ball burnishers, tungsten carbide burrs, Toffelmeyer retainers, both contra-angle regular, ivory number 1 retainer, striped matrix band, ivory number 1 retainer band, wedges, high speed handpiece, a slow speed handpiece, amalgam polishing kit with amalgam rubber polishing rubber points, a dental floss to pass through the clapbacks in Class 2 amalgam restorations, glass slab to mix cement.
A Class 2 carious lesion develops apical to the contact area on the proximal surfaces of posterior teeth. The procedure for removal of the carious lesion is the same as that of a Class 1. The first step is the development of the ideal cavity preparation. By doing an ideal cavity preparation, the extent of the carious lesion on the pulpal, lateral, and axial walls is seen. If there is any remaining carious lesion, it is removed. Any remaining carious lesion is removed only after establishment of the ideal internal and external outline forms. The mark on the marginal ridge of the tooth structure indicates contact with the adjacent tooth. Before placing the rubber dam, mark the centric stops using articulating paper and tap the teeth together into centric occlusion. The blue markings left by the maxillary lingual cusp are supporting contacts of occlusion and should be noted prior to establishing cavity outline form. The Class 2 cavity preparation is done in 2 stages: the occlusal segment and the proximal segment. Penetrate the burr 90 degrees to the plane of the occlusal surface with the burr tilted slightly laterally for ease of penetration. The initial outline form should include only the faulty or defective occlusal pits and fissures. Begin the occlusal segment of the tooth preparation by entering the deepest or most carious pit, orienting the burr 90 degrees to the occlusal plane. The burr should be rotating when it is applied, and it should not stop rotating until it is removed from the tooth. As the burr enters the pit, establish the initial outline form by extending the external walls to sound tooth structure and by thinning the defective marginal ridge as much as possible. The proper depth of 0.5 mm into dentin should be established. With intermittent pressure and continuous movement from one point to another following the DEJ, continue to maintain the burr's orientation and depth. Ideally, the width of the isthmus should be just wider than the diameter of the burr. The orientation of the burr should change to satisfy the direction of the different occlusal walls of the cavity. The carious lesion can be seen at the dentino-enamel junction. We can see the carious lesion now because the enamel has been removed. Before dropping the box, the marginal ridge is thinned out as much as possible. This thinned out shell of enamel provides protection for the adjacent tooth and is also a guide for dropping the box. After the occlusal segment has been developed, the following are seen. 1. Defined line and point angles. 2. Buccal and lingual walls parallel to each other and 90 degrees to the occlusal plane. 3. The mesial or distal wall is divergent pulpo-occlusally in the case of a mesio-occlusal or disto-occlusal cavity preparation. 4. All defects and carious lesions are removed and walls are placed in sound dento-enamel junction. 5. All unsupported enamel rods are removed and all walls are finished. 6. All margins are smoothed and curved. 7. The marginal ridge is thinned out as much as possible and gives a clearer view in order to access the proximal box. 8. The dentino-enamel junction is visible and clear. 9. Resistance principles are followed when walls are curved and extend around the cusps. 10. The margins are placed on smooth and sound tooth structure. Due to the morphological shape of the tooth and the contact area, the buccoproximal wall on the mandibular molar makes an acute angle with the gingival floor, and the lingual proximal wall makes a less acute angle. The initial step in preparing the proximal segment is to place the cutting end of the burr on the DEJ, 1/3 in dentin and 2/3 in enamel. Pressure is directed gingivally and lightly towards the enamel shell to keep the burr against the proximal enamel. While the burr is moved facially and lingually along the DEJ, it should be oriented according to the proximal wall directions, occlusopulpally. The burr should also be oriented correctly proximo-axially to visualize the complete mesiofacial and mesiolingual margins at right angles to the proximal surface. The gingival margin should be extended gingivally to clear the adjacent tooth by 0.5 mm and to remove the entire carious lesion. A slot has been prepared, which is partly in enamel and partly in dentin. The slot is diverging gingivally to ensure that the facial-lingual dimension at the gingival is greater than at the occlusal. At this stage, a low-speed handpiece is used to define and finish the box. With the high speed, make 2 cuts extending toward the perpendicular to the proximal surface to weaken the remaining enamel that can be removed. After the proximal segment is developed, the following are seen. 1. The buccoproximal and lingual proximal walls are 90 degrees to the tangent of the tooth structure. 2. The bucco and lingual proximal walls are parallel to the enamel rod direction. 3. The buccoproximal wall makes an acute angle with the gingival floor, and the lingual proximal wall makes a less acute angle. 4. The flare or divergence angle is 90 degrees to the tangent of the tooth. 5. The axial wall is convex in the horizontal section. 6. The axial wall is 0.5 to 0.8 mm into dentin. 7. The reverse curve preserves the triangular ridge and facilitates the formation of a 90-degree angle between the proximal walls and the tangent of the proximal surface. 8. The occlusal and proximal segment flow together smoothly. At this stage, hand instruments are used to remove ledges and any unsupported enamel from the buccoproximal and lingual proximal walls. Be certain to hold the instrument parallel to the wall. Do not tilt the instrument or excess flare or a bevel will develop. Hold the hatchet parallel to the wall, and if there is any unsupported enamel, it will be removed. The instrument should be held parallel to the wall that is being worked on, and 90 degrees to the tangent of the tooth structure. Notice the unsupported enamel that was removed. Be sure the axial wall and gingival walls are smooth. Always use the instrument from the bevel side to the non-bevel side. Place the primary cutting edge against the gingival floor and the secondary cutting edge against the axial wall so everything can be done in one stroke. Turn the instrument around for the other side. At the buccoaxial line angle, carefully remove any ledges. Do the same for the linguoaxial line angle and the axial wall. Use a gingival margin trimmer for planing the gingival cavosurface margin. By planing, we develop a small bevel and all unsupported enamel is removed. The gingival margin trimmer is also used to round the pulpal axial line angle. Rounding the pulpal axial line angle decreases the stress on the tooth structure and the amalgam restoration. To review, the occlusal segment was developed and the pulpal floor placed approximately 0.5 mm into dentin. All walls were connected with a smooth curve and there are no catches in the groove area. There is now smooth and continuous flow of the preparation. The reverse curve was established. The axial wall was rounded to follow the external outline of the tooth structure and is 0.5 to 0.8 mm into the dentin. The buccal proximal wall is 90 degrees to the cavosurface margin of the tooth structure. The lingual wall is 90 degrees to the tangent of the tooth structure. There is an acute angle at the buccoproximal and lingual proximal walls. The gingival cavosurface margin was planed and unsupported enamel removed. The Class 2 cavity preparation is complete.
This will be the final shape of the Class 2 amalgam cavity preparation, showing the proper occlusal and gingival clearance from the adjacent tooth.
The matrix retainer has 4 parts. The head, which is U-shaped, has 3 guides or slots for the position of the band. The locking vise is a sliding body that holds the band. The long knob changes the diameter of the loop, while the short knob locks the band in place within the sliding body. To prepare the retainer to receive the band, turn the long knob to move the locking vise all the way down to the head of the retainer. Then turn the short knob to loosen the retaining screw. The retaining screw should disengage from the sliding body. Fold the band to form a loop. Notice that when the band is folded, one edge has a smaller circumference than the other. This design accommodates the difference in tooth circumferences at the contact and gingival levels. There are 2 main rules for correct placement of the matrix system on the tooth. 1. Open end of the retainer head is always placed toward the gingiva. 2. Smaller circumference of the band is always placed toward the gingiva. These rules serve as a guide to how the matrix band must be positioned in the retainer. With the rules in mind, place the two ends of the band in the slot of the locking vise, with the occlusal edge of the band facing the retainer, and position the band in the correct slot of the head, such that the rules above will be satisfied. Turn the small knob clockwise, lowering the screw into the vise and thus locking the matrix band within the retainer.
Matrix band burnishing is done using a blunt end of a back of an instrument. The blunt back end of an instrument could be either spoon excavator as done here, or could be gingival marginal trimmer, or could be back end of a tweezer. This burnishing is done on a soft base. The matrix band is kept on a soft tissue napkin or on a paper mixing pad. The objective of burnishing the matrix band is to get proper contour shape in matrix band. The matrix band contour shape is essential to achieve a proper contour tight contact in a class 2 amalgam restoration. Burnishing of the matrix band is continued till the proper contour of the matrix band is achieved.
The band should be seated around the tooth such that the occlusal portion of the band extends 1.5 to 2 millimeters above the marginal ridge of the adjacent tooth and the cavosurface margin. This allows for proper condensation of the amalgam in the marginal ridge area. The gingival portion of the band extends 0.5 millimeters below the gingival cavosurface margin. To tighten the matrix band around the tooth, turn the long knob. This will pull the matrix band up along with the sliding body, thus decreasing the diameter of the matrix band and tightening it around the tooth. Tighten the matrix as much as possible around the tooth. This allows for proper amalgam condensation and contour development. To place the wedge, stretch the rubber dam tightly to allow it to seat more gingivally and keep it from getting caught by the wedge. After placing the wedge, use the blunt to check that the matrix band is tightly adapted to the gingival surface. Use an explorer and try as hard as possible to place the tip between the matrix band and the gingival cavosurface margin. You should not be able to do so. This also helps to remove any unsupported enamel left in the area. Place the wedge. Once it is seated tightly in the gingival embrasure, loosen the matrix band slightly by turning the knob 1/4 of a turn. This prevents the matrix band from being too tight, which may lead to an open contact and may hinder proper condensation of the amalgam into the proximal cavosurface margin areas. Finally, use a spoon excavator or burnisher to burnish the matrix band to the adjacent proximal contact area.
This will be the final position of the matrix band and wedge when adapted to the film surface with no gaps.
Load the amalgam carrier with amalgam from the well. Place the amalgam into the occlusal segment of the prepared cavity. Begin condensation using a small condenser to condense a portion of the amalgam into the proximal box area. Place pressure and condense into all line angles as well as against the matrix band. Next, use the largest size condenser that will fit into the proximal area to condense more of the amalgam into the proximal box. Again, be sure to condense pulpily and laterally, adapting amalgam into cavity walls and line angles and into the matrix band. Remove any amalgam at the surface that appears shiny and wet. This contains the excess mercury that has surfaced during condensing. Place additional increments of amalgam and continue condensing pulpily, laterally, and against the matrix band, removing any excess mercury that comes to the surface. It is important to overfill the cavity with a generous amount of amalgam, so that the proper occlusal anatomy can be attained during carving. If necessary, mix another cartridge of amalgam. As the cavity becomes filled, condense and smear amalgam into and over the cavosurface margin. Immediately after completing condensation, use the explorer to separate the newly condensed amalgam from the matrix band, to define the contact area and marginal ridge, and to define the occlusal embrasure. This is done by resting the tip of the explorer against the matrix band and moving the explorer from the lingual proximal margin toward the buccal, stopping at the center of the box. Repeat this procedure again, this time starting from the buccoproximal margin. Use the beaver tail to remove excess amalgam from the occlusal surface without touching the cavosurface margin. Remove the matrix retainer. Holding the band in place with your finger, unscrew the matrix retainer and remove it from the band. Carefully remove the band from the tooth, except at the proximal surface that is being restored. Fold the band back away from the tooth at this area. Occlusal carving is started when the amalgam shows some resistance to the carving instrument. Use an explorer, discoid, or cleoid to test the amalgam for resistance. Angle the cleoid so that the tip rests in the area where the secondary groove will be, and the side rests against the remaining tooth structure of the cusp. The instrument is inclined so that the existing tooth structure can help shape the amalgam, thus restoring the natural occlusal anatomy. Occlusal carving is done with a pull stroke. However, the push stroke can also be suitable in developing occlusal anatomy. Form the distal and mesial pits first, followed by the buccal and lingual grooves. Once occlusal anatomy is complete, use a moist cotton pellet to smooth the occlusal surface of the amalgam. Carefully remove the matrix band by rotating it and sliding it out of place. Place the tip of the explorer against the adjacent tooth, with the blade resting on the existing tooth structure of the tooth's proximal surface, and use a shaving motion from cervical to occlusal to shape the proximal surface and remove any excess amalgam. Use one of these instruments to also remove any excess amalgam from the cervical region to define the gingival cavosurface margin. Proximal carving should define both the occlusal and gingival embrasures.
This is the shape of the final restoration with no gingival overhangs. Once the carving procedure has been done, post-carve burnishing is initiated to impart the final smoothness to the restoration.